Join us now for Health for Life, brought to you by Hamilton Healthcare System.
Today we're talking with Dr. Nancy Carnevale of Anna Shaw Children's Institute in Dalton. Thank you for joining us, Dr. Carnevale.
Thank you for having me.
Dr. Carnevale is a board-certified child development pediatrician and the medical director of Anna Shaw Children's Institute, located at 1201 Burleson Road behind Hamilton Medical Center in Dalton, Georgia. She specializes in attention disorders, autism spectrum disorders, behavioral and developmental challenges, and more. Dr. Carnevale graduated from Assumption College in Worcester, Massachusetts, attended medical school at Brown University in Rhode Island, and completed her residency in pediatrics at the University of Connecticut. She also completed her fellowship at Brown University and is board certified in neurodevelopmental disabilities. Let's start with the basics. What is a routine, and why would routines be important?
So a routine is a sequence of actions that occur in order. So they can be repetitive, kind of automatic. So we're not even really thinking about them when they're occurring. By having that automatic routine, we don't have to think about making a decision, and then that kind of prevents decision fatigue. We have routines in our work tasks, in our personal hygiene tasks, social, all parts of our life. So when you get up in the morning, you come to work and you follow a certain routine. You get dressed, you eat breakfast, you drive to work, etc. And then you have routines when you get to work. Routines provide a structure and consistency, which then can reduce stress and anxiety for the whole family. When we know what's going to happen, then we worry less. Routines make us more efficient, so we get things done faster. They also promote nice, healthy habits, such as good eating and sleeping. They can teach children responsibility and self-discipline. And routines can also be a fun way for families to bond and create lasting memories.
So in your opinion, you would say that routines are very important to establish?
Yes, I think that they're really helpful. For example, a morning routine would be getting up, using the bathroom, getting dressed, having breakfast. And the important things about morning, however, I could just want to throw in there, is starting the day off with a positive attitude. So that morning sets the tone for the day. So you want to start it with some positivity. Today's going to be a great day. And that can help get your family going on a positive note. On the reverse of that, if you get off to a bad start, you're going to ruin the whole day. So I always tell parents, try not to be rushing. Try to keep a consistent wake time. Don't let your children sleep in on the weekend for too long, because then they won't be able to readjust on Monday.
Are there routines around meals or exercise?
There's lots of routines. And one that I just, again, really want to emphasize is that family dinners are really important. They bring family together and they encourage better communication. And they've done studies that have shown that family dinners are associated with a range of positive outcomes. Better academics, higher self-esteem, better mental health, better nutrition. They lower there's an association with a lower risk of substance abuse and obesity, and just better family relationships. And it may not be a causal thing, but there's an association. So it tells you there's something is very positive about having a family dinner. A couple of other routines are establishing a really good homework schedule, assigning chores to young children, because that will teach them some basics of responsibility and, again, help to boost their self-esteem. And then exercise routines, trying to, again, that can become a great way to promote, again, physical health and bonding with your family.
Then speaking of those exercise routines, could you give us some tips on how families could kind of incorporate that into their routine?
Sure. A regular schedule that really helps, that works for both you and your child, and try to make it a family activity. Sometimes you can offer incentives. If you do so much exercise, then you can watch TV for 10 minutes. Provide positive feedback. Good job. I'm glad that you did that. Make it accessible. So you want to have something that you can do. Maybe just go outside and play basketball. And of course, limit screen time. And creating a habit of exercise like that can take a long time. So you have to be patient and be persistent.
You mentioned limit screen time, and I know that might tie into evening routines and closer to bedtime. Can you share some ideas for those?
Sure. And we will talk about bedtime routines, but definitely you want to turn off the screens. There's something called a blue light that emits from screens, and it makes it hard. If you're watching screens, it's hard to break from those screens, and that blue light may actually affect your sleep. So we really do talk about turning off screen time hopefully by like 6 o'clock at night.
So that would directly affect kind of more of the bedtime rituals?
Yes, for sure, for bedtime rituals, but also just, our kids are using too much screens in general now. We want to limit their screen time so they get more exercise, so they read more.
And what about setting a good example for those children?
Children learn skills by basically modeling us, by modeling their parents. So if we're a parent who stays organized, plans ahead, uses a calendar, we have a routine ourselves, children mimic that. On the other hand, if we're always running late, we're disorganized, our children are going to mimic that too, and they may struggle to develop those skills.
Yeah, and that's very important to mention. And could you share ideas for weekly and monthly routines that families could establish to help these issues?
Sure. So some ideas include designating 1 day a week for a family cleaning, and you'd all work together, a few hours, get the house cleaned. Heading to the grocery store together for a weekly grocery trip, making a list. And then I think a really important thing to do is setting aside just at least 1 day each month for some family get-together, an outing, a trip to the zoo, a hike. Put it on the calendar, make it a priority. And these routines can help families stay organized and bond. And these are the things that kids remember. These are your lasting memories.
So what about some of those evening routines and bedtimes?
So again, establish a routine of winding down before bedtime with activities such as reading, listening to calming music. Try to get organized for the next day. So have everyone lay off their clothes, pack up their bags, put them near the door, get their shoes out, and that will minimize the chaos for the next morning. And of course, establish a regular bedtime and stick to it. Kids who have a regular bedtime do better. There's something we call the 3 Bs, and the 3 Bs routine is a simple and effective way to establish a bedtime routine for children. It consists of 3 steps: brushing your teeth, reading a book, and going to bed. And a consistent 3 Bs routine can help children wind down, prepare for sleep, and again, establish those healthy sleep habits.
Well, those are some great ideas. But before you go, can you tell us a little about the Anna Shaw Children's Institute?
Anna Shaw Children's Institute is dedicated to the memory of Anna Sue Shaw, and it's a regional leader for the care of children ages birth to 11 who experience challenges of developmental delays. We have therapies for children, including physical therapy, occupational therapy, speech therapy, feeding therapy, and psychological services also. We have a lot of psychological services, including individual counseling, family counseling, and behavior support services. Cognitive, psychological, developmental evaluations are conducted at the Institute to assess each child to help establish their skill set and identify the appropriate therapies or services in order to maximize a child's development. We also have what's called a treatment navigator, and that's a dedicated Institute employee who will support families through this diagnostic and treatment process.
Wow, well, that's wonderful that all of that is available to families here in our community. For more information about Anna Shaw Children's Institute, call 706-226-8900 or visit hamiltonhealth.com/children. For an appointment at the Institute, please ask your child's pediatrician for a referral.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.